Hey everyone. So I just wanted to hop on and give an update of what I've learned this last week in school. So we primarily studied minerals this week. The first mineral we studied was calcium. Calcium is the most abundant mineral in the human body. In order to ensure normal calcium absorption, it's important to have good vitamin D levels. So natural ways to get vitamin D are through sunlight, about 10 to 15 minutes daily prior to putting sunscreen on. Some good sources that are rich in calcium citrate would be lime and lemon juices. So you could squeeze it in warm water or your tea. That can definitely help increase calcium levels naturally. If you need to take calcium supplements for some reason, it's really important to take it with meals and then also potentially with a magnesium supplement. The reason of that is to help minimize the risk of kidney stone formation. So you would want to avoid that if at all possible, or if you've had a prior history of kidney stones that were found to be high in calcium. Also, there was some precautions with taking calcium supplements, so something to consult with your provider and or pharmacist about. Um, Calcium can sometimes inhibit the absorption of certain medications, and then also taking with certain medications could potentially increase the risk of hypercalcemia. So that's where levels of calcium in the body become too high. So definitely one to discuss with your primary care doctor prior to taking. The next mineral we looked at was chromium. Some natural good sources of chromium would be good wholesome grains and eggs. Iron was the next mineral we looked at. Iron is essential for the delivery of oxygen to tissues. So if you've ever heard of iron deficiency anemia, it's a fancy term for the blood counts are getting low due to inadequate iron intake or absorption in the body. So really important for energy, for oxygenation, lots of things. Also in patients with thyroid disease, especially hypothyroidism, an underactive thyroid, ensuring that you're getting adequate dietary iron is very important for that. Some good sources for iron would be meat, poultry, fish, leafy green vegetables, beans, and whole grains. Iron is the most common nutrient deficiency that exists. So definitely ensure that you get enough iron. Iron is best tolerated if it's taken after meals, as far as to minimize the GI upset. Also, the timing of taking the iron supplements with other medications is really important, as it can potentially affect the absorption of either iron or the medication. So consulting with your pharmacist if you take a supplement about the timing of when to take it. Also with iron supplementation, it can make the stools like a darker color. So just knowing that could potentially happen as well. Magnesium was the next mineral we looked at. So some good food sources of magnesium are nuts, whole grains, legumes, leafy green vegetables, fish, meat, and dairy products. Also, magnesium is another supplement that it's important to consider the timing, especially if you take other medications. So consulting with your family provider or pharmacist about this. The next one we studied was selenium. So some good food sources of selenium are Brazil nuts, organ meats, fish, whole grains, and legumes. Vegans are at a greater risk of selenium deficiency, especially compared to vegetarians who may consume like eggs and dairy products. The next one we looked at was zinc. Zinc can be used topically for acne treatment. Also zinc, if you've heard of like Zicam, that can be helpful in reducing the duration of cold symptoms. And also zinc can be really helpful for wound healing. So in some of the creams for patients with delayed wound healing or that go to like a wound treatment center, that may be in some of the creams to help promote tissue healing. Another important like side note, so on patients who take acid suppressive therapy, so that would be like Protonix, Pepcid, those proton pump inhibitors, especially in patients taking it long term. So long term would be 6 to 12 months. That really can have an effect on the body's ability to absorb several different types of vitamins and minerals. So if you're on long-term use of these acid suppressive therapies, Either number one, consult with your primary care provider or your GI specialist to see if it's still medically indicated, because it may be. But if it's not medically indicated, maybe talking about potentially weaning off of that, because long-term use of that can end up resulting in several deficiencies in various vitamins and minerals, which are important for overall health and well-being. So I hope you learned something. If you did, drop it in the comments. Thanks for listening, and I'll see you all again soon. Take care. Bye.